Hey, everybody. So good evening. It is good to see you guys, 8 p.m. on a Monday night. Hopefully your Monday's going okay. I know there's storms like in Charlotte and in Tennessee and all kinds of all over the place. So hopefully everybody is good and doing well. I'm going to pop this up to make sure I can see you guys and see your comments coming through on here. If I was on the comment screen, that would help, wouldn't it? So say hi when you come in, and we'll kind of get this thing rocking and rolling tonight. I'm really excited. You heard me talk about this all last week, and the reason why is because I just think it's really important for parents, grandparents, caregivers, guardians to get the best information you can possibly have about what's going on and how it's affecting our babies. And I'm super grateful for my guest tonight, which is Dr. Jeansonne. You guys have heard me talk about her probably off and on over the years, but especially recently because we've had conversations and she is a voice. Yay. So Nicole is able to come too. I'm excited. So that means we have two pediatricians. This makes it so much even better. I'm super excited. Yeah. Okay. So I can see it. Everybody's good to go. Making sure that I've got you guys here. All right, so I should be able to see comments. Okay, so here's the deal. I've got two great pediatricians on. I know Dr. Jeansonne personally, and this is one of her peers who she trusts and recognizes. And so for me, it was really important to get representation on here as well. And you might be saying, what do you mean by representation, Danny? Here's what I mean. One of my frustrations in having conversations around COVID-19 and treatments and vaccinations has been two sides. One are with my folks who tend to be more conservative, more right-wingish, and my Black and brown folks, my people of color. There's these two worlds where everybody's really distrusting and there's a lot of misinformation out there. And so when I talked to Dr. Jeansonne, she was like, well, do you think it would be better if you had like somebody else besides me who was a person of color? I said, no, I would love to have both, because the more representation we can have, but we receive information better when it comes from people who look like us. That's just the reality, right? Unless there's a relationship there. So I'm really excited to be able to share that with you guys. And I still can see, so I can see Marian, I can see Andrea, I can see Teresa, Chelsea, I can see you guys here. I don't see you on this screen, so I'm glad I've got them both up. But without further ado, I'm going to bring on Dr. Jeansonne and is it Mcguire? Am I saying that right? Last name for okay, and bring them on. I'm gonna let them give you a little bit of introduction as to who they are, the area that they work in, and then we're gonna kind of dive right in. I've got a list of things that I want to make sure that we touch on, and then I do want you all to be able to ask questions too as well. So let me go ahead and add them to the broadcast. And I will tell you, so Dr. Jeansonne messaged me like 30 minutes ago. She was like, my power just went out. Can I join by my phone? So even though she's in the dark, we're gonna rock with what we've got. So first, let me say this to both of you all. I'm very, very grateful. I know how hectic and busy your lives are, especially at the moment. And so for you to take the time to do this, I'm very appreciative. And for me, it's like, even if it's just a couple of people or 100 people or 500 people who are able to see this and it helps, then it's really worth it. So I do want to first thank you guys for taking the time to be here. Dr. Jeansonne, give the folks a little bit of background as to who you are, what you do, and where you're at.
Okay. I'm a pediatrician, and I live in Northeast Tennessee in Kingsport, and I've been here since 2005. I've worked in employed practice with Mountain States Medical Group and HMG as a private practitioner, but I worked probably the longest period of time at Niswonger Children's Hospital in the ER. And then unbeknownst to me that a pandemic was going to come along, I started my own house calls practice. I started preparing for it at the end of 2019, and my start date was April 1st, 2020, in the middle of the lockdown. So I've had some interesting pivot trying to make my way through the pandemic. And Nicole, hi.
So, and Nicole, I will go ahead and give you a minute to kind of introduce yourself. Tell folks where you are. I'm familiar. I already know where you're at. And I know that your area is really hard hit. So if you can share a little bit with folks about, kind of how you all know each other and a little bit about you, that'd be great.
Hi, I'm Dr. Carly Mcguire, and I'm a practicing pediatrician in Houma, Louisiana. And for those that aren't familiar, it's about an hour southeast of New Orleans area. Louisiana has been very hard hit with this COVID surge. I've been in Houma since about 2002. I was previously employed in private practice, and then from there started my own practice with a partner. In the past 2 years, I've been practicing community pediatrics at a FQHC.
Okay. So I've got two pediatricians. You all know I have grandbabies. Everybody who follows me knows I have three grandbabies. And so the kiddos are near and dear to my heart. They just always have been. And I think, last year, everybody was like, okay, well, I mean, it's just really affecting, this sounds bad, but people were like, okay, but it's old people, right? But what we're seeing now is a little bit of a different thing with this Delta variant, and we're seeing it impacting our kids. And I know in the state of Tennessee, it's become a very polarizing, very political conversation that has me frustrated. So I said to you, Dr. Johnson, I said, I don't know if you saw it or not, but our governor today issued an executive order allowing parents to opt out of any mask mandates that their school boards may pass. So the first thing that I'm going to ask you guys is, what, from a pediatrician medical standpoint, what do you think are the best things that we can do for our children? I know that we're all advocating in-person learning. We also want to advocate to do it safely. So, Dr. Jeansonne, what would you say from your position as a pediatrician, you would like to see for our kids?
Right. Well, I think we all realize they do need to be present in school, and that's been the terminology. And I think a lot of pediatricians here felt that way last year and wrote letters saying they need to be present in school. But one of the things that started to happen is, and I always hate to use these lingo words because sometimes it shuts people off, but it truly is a false dichotomy that we can't do more than one thing to achieve, less of a stress on our healthcare system and on us in general, like parents who are working and are having to take off for quarantine and other things. So, I do encourage masking. I don't think it has to be mask, no mask, like a big fight. I think there's lots of gray area, but we saw last winter, I've never had a winter that I didn't see RSV. So from a pediatric standpoint, we saw in many ways that it might not have prevented all of the coronavirus, but it sure helped with the burden of other viral illnesses. So physically distancing, I don't like the word socially distancing. We already feel so isolated. But physically distancing, making sure we're hand washing, positive messaging around masking. I think that some children see their parents give negative messaging around masking, so it makes it negative. But there can be positive messaging. And I get it. I think that I have two children who are extremely different. And I have one who would have been really careful wearing her mask and following everything and wanted the teacher to praise her for properly wearing her mask. And then I had a son who would have probably been making it into a little thing he could stick up his nose, right? And he would have probably been sent home with a little red dot every day. But I think we can do our best, right? We can only control so much, but right now we're not really doing our best. We're not even doing half best, but we could do our best.
Yeah. So along those lines, one of the things that I said in the broadcast on Thursday, because there were parents that I had on who were very concerned about not only what the school boards were and weren't doing, but they were concerned about their children being bullied and being teased for wearing masks. And one of the things, I put a clip up from the Williamson County Board of Education meeting, and I said, do you want to know why we're scared about children being bullied? Because these are parents that are bullying medical professionals and bullying Board of Education members. So when you say, we're not even doing half best, we're not. We're creating an environment that is already hard enough on the babies, and it's making it even worse. So hey, Wendell, thanks. I'm glad everyone is tuning in because we all know somebody with kids and small children and kind of finding our best way to navigate this. I do love the fact that you said physical distancing instead of social distancing. I do think people have forgotten that we need to be connected to each other. We need to feel like we're, that no man or woman is an island kind of thing. So I'm not as familiar with what's happening in Louisiana in terms of masks and not wearing masks. From your perspective, what would you like to see in terms of being able to be present in class learning and still be able to do it safely?
Well, in Louisiana, our governor a few weeks ago made it a mandated indoor masking for anyone age 5 and older. So our schools started and this was probably like a week before school started in Louisiana. So in my parish, we have parishes instead of counties, just to clarify. So
Yes.
I'm in Terrebonne Parish. And so our public schools opened last Tuesday. So now we're weekend school. They have, for the most part, people are willing to mask, I think because they're scared because of the numbers are so high, and also because our hospitals are overwhelmed. Actually, we're asking people not to go to the ER unless you really have to. Our urgent care is overwhelmed. I work at a FQHC, and we're getting a lot of, similar to last year, when the ER started to get overwhelmed, we start to get that backflow. Well, this year is even higher in the pediatric population. So I find there are some people that, of course, anywhere they're against masking. But for the most part, I think that people are accepting of it. I think because of the fear. And because we're talking about younger kids that don't have the opportunity to be vaccinated.
So I want to talk about a couple of those things that are really that you all touched on. So my grandchildren just moved outside of the Tennessee area, and the school district where Dominic was going to go, not only are they not doing mask mandates, but last year they had purchased desk shields, right? So this is a tool that they already have, and they've taken them down. They've taken them down, not using them, not doing masks, not doing anything. And I think for me, we were just, well, so you may not know, Nicole, but my granddaughter Bella was born, even though she just turned 4, she's born at 26 weeks. So high risk, lung issues, all of that. And so because of that, we've had to say, okay, nope, we can't do that. And I think we've created this very polarizing world where it's either or. And there's no like middle ground. So part of what I heard when I was listening to the Johnson City Board of Education meeting the other day was they were saying, well, listen, when teachers are doing like in front of the classroom instruction and they're already social distance, yes, take that sucker off. It's good to go. That's fine. In other places though, it's just nobody's wearing anything. And that's where it gets a little bit concerning. How frustrating is it for you? Like today I posted about Vanderbilt Hospital saying, hey, our beds are full and we are no longer taking transfers from other places. And immediately somebody posted this link and said, yeah, well, they shut down half their staff, or they got rid of 200 staff last December. So this is not a COVID issue, right? It's a staffing issue. And I said, really? Because they didn't turn away transports for the transfers for the last 8 months. So even if they dialed back beds in December, right, it's almost like people want to use something to negate the very real issue that we have of rising COVID numbers. So in your experience, have you all ever seen anything like this, especially when it comes to children?
Anything as far as the number of hospitalizations?
The number of hospitalizations and the severity of what we're seeing with some of our kids.
Years ago, I recall Dr. Jeansonne, I guess during residency, RSV was even bigger. So for us, we trained at a children's hospital in New Orleans, and during RSV season, we knew that we were going to be overwhelmed. So a lot of times we were, keeping just the sickest kids in the hospital. Anyone that was well enough to go home, we were able to try to transfer out just to try to secure beds. But similar to what you were saying, last year, I think because of the masking, we didn't see RSV as much during the winter months, not even as much in the spring months. But once the masks were removed, and the rules were relaxed. This is the first summer that I've ever seen as much RSV as we've seen.
This summer. I
So
had
that's the
another
only thing I could really compare it to, like years ago with RSV, before Synagis became as widely used.
I think that people don't understand. Like you'll see people post and they'll say, oh, well, what miraculously happened to the flu and what miraculously happened to RSV, as if somehow this talk about COVID means those other things went away, but they forget. We were doing a lot of physical distancing and people were quarantining in place and there was a lot of hand washing and sanitizing and masks. And so naturally those other things went down. It doesn't mean that COVID isn't real or that COVID is being used to scare people. It means, hey, we were taking really good precautions and we saw some benefits because of that. But I had another pediatrician that I know in Nashville say to me, hey, RSV's here this summer already, and with a vengeance. And so those two things combined together are really wreaking havoc on everyone. Dr. Jeansonne, you participated in one of the clinical trials for the COVID-19 vaccine. And there's so much information. I don't even know if you want to call it information. I guess it can be information. Sometimes it's not valid, but there's a lot around that. Share with people why you chose to do it, what that experience was like, and what are the biggest takeaways or things that people should know about the vaccines that we do have available.
Sure. So a lot of my patients and peers know this, but not a lot of other people. But I have moderate persistent asthma. And as a pediatrician in the emergency room and every winter, I really did struggle, even though I'm on a couple different medications every day and I have a really good step-up plan. I really struggled with doing inhalers and breathing treatments in between seeing patients, and even sometimes having conversations with my husband about whether we should go to the ER and I should be admitted to the hospital or not. Fortunately, I'm a physician with friends who are physicians, so it did make me recognize that I had some benefit in getting treatment early. But one of the things that over my career I recognized was in years where influenza or flu showed up early, which I will never forget. 2003, influenza showed up in early October in Louisiana, and I had not had a flu vaccine yet. And it was really detrimental to my health. And there was another time that something similar like that happened to me where I didn't have great access, or maybe there was some laziness on my part about getting my flu vaccine. And I got very ill. And I realized over time that the years that I had vaccine, I may have had breakthrough influenza illness, but there was a big difference in how my body reacted and how I felt better protected, even though it was still a struggle. So, as I started to see that there were going to be trials, I started looking into joining the Moderna or Pfizer trial and looking at what it was. And obviously, as a pediatrician, I have incredible confidence in vaccines. I know that, it hasn't all been like roses and happiness and rainbows in the history of things with polio. But during my lifetime, I have seen the difference in the effect of Prevnar and the Hib vaccine, and the difference in the amount of times I have to do lumbar punctures or draw kids' blood. I've seen that difference. And I've heard from my mother, who's 83, how all my siblings had measles and it was terrible, but I was able to get the measles, mumps, rubella vaccine and have not had it. So I haven't had chickenpox. I'm immunized for chickenpox. So, for me, it was like I was willing to put my body out there because I had confidence in the platform and in Pfizer. That's the study that I ended up joining. It was local. And I was willing to be that person to see if it would work. And I didn't know if it would or not. And of course, we're seeing breakthroughs. I'm not happy about that. I'd love for it to be 100%. But I was willing to do that to show other people like my experience and what I went through. And I don't regret it.
So I didn't know that you had asthma. So when you hear people talk about, oh, well, I have asthma or I have this or I have that, and I'm hesitant, like well, you and I have talked about this a year ago. I was, when they were first talking about this warp speed in the vaccine, I was like, pump your brakes. I'm good. No, thank you. Right.
Right.
And then for me, what it took was watching the process unfold and finding out which one made more sense to me, because like you've heard me say this, I am distrusting of some things when it comes to medicine and the government and whatever. I'm a disabled veteran, and so I just have experiences that have tainted the way that I view things. And so for me, I ended up going with Pfizer, and it came down to, well, what makes the most sense? Like, what are the risks and what do I want to weigh out? And how do I do my part? I think sometimes people forget that what we choose, yes, it's your choice what you choose, but what we are choosing impacts everyone else. And I think because most of us have never seen anything like this, because we're not doctors and physicians in our lifetimes, we don't really get what we're in the midst of. You know what I mean? And I think about mental health aspects and what that's going to be like for decades to come. We don't know what the long-term effects of COVID are going to be. There's just so many unknowns that make me go, okay, I'm not an expert, but there's a reason there are people who are experts. And, if I'm going to trust anybody, it should be those individuals. And so I had conversations with people that I know, that I trust. I trust Dr. Jeansonne. I trust Dr. Youssef. I trust certain physicians and people to be able to say, hey, listen, I get it. And realistically, this is the best thing. Do you want to add anything to that?
Yeah. Even like regarding the vaccine, for myself initially, I was a little nervous when there was first mention of the vaccine. So I wasn't initially on board with it. But just like anything else, I find that it's important to research, use credible references. I don't always just go to social media for my information. So I think you have to just kind of get out there and ask questions, and make sure that it's credible information that you're receiving.
I was
and
saying,
it's okay not to know or say that you don't know, because it was something new. It was something new to everyone.
yeah,
But like I said, for myself, even being in the medical profession, it was important for me to get more information before I made the decision to do so.
I did this.
So everyone in our household has been vaccinated. I have one son that is underage, so we're waiting for him to be able, for it to be approved for his age. And that's the child that has asthma. So he's the one that I worry about a little bit more. And that was also part of the reason why I made the decision to become vaccinated, because it's not just about me and my health. I'm a provider, so I'm taking care of other people's kids. And so we have to treat them as if they're our own kids. What I would do to protect my kids, I would want to do the same thing for my patients.
Yeah.
And also for my parents at that time, they weren't able to be vaccinated. Of course, they did it in tiers. So at that time, my parents weren't able to be vaccinated. And so just to make sure, we had all been socially distanced for months at that time. And so, aside from FaceTiming or, talking on the phone or texting, you've been seeing your family. So what faster way to be able to make those connections but to get vaccinated. And so that played a large role in my making the decision.
I wanted to go to LA to visit. It was my birthday in May, and my oldest daughter was like, Mom, I want to fly you out. And I was like, girl, I can't get on no plane without a vaccine. like I can't do it. But those were some of the things. And then having seen Bella already, like at 26 weeks, 1 pound, I've seen her on a vent. I've seen her, I've seen that. And when I started, I was like, gosh, if I did anything that caused her harm, I just don't know what I would be able to do with myself. But you said something that is so important. So what I have seen consistently is people talk about these conflicting reports and conflicting data. I actually listened to a physician, and she already knows I'm not a fan. And everybody who's watching me knows I'm not a fan. You saw my whole face just change, because I believe that medical professionals have a responsibility that comes with the trust that community gives medical professionals. So I think when you speak, you have to be very careful. And so there's a local physician who's on a board of education. And I listened to her talk about the fact that there are conflicting reports about whether or not masks work. And that a pulmonologist sent her reports about this and that. But you said credible. And I think that's the thing that people forget is sure, you can find conflicting data in just about anything. I joked earlier and I said, ask my ex-husband about my marriage. You're going to get conflicting data from what I'm going to tell you because we have a different experience. But is it credible? So for example, like I'm going to have my opinion, but my neighbor who doesn't live in my house, who doesn't know what my marriage was, right? So that person's data might be conflicting, but it's irrelevant. And so it's credible. So when people want to go to credible sources, I look at the CDC and I look at the American Academy of Pediatrics and I look at places like that. What are some of the best resources that you think people and parents should be using during this time?
You named two of the best resources, definitely for pediatrics. Also, I guess for if we're talking about outside of pediatrics, the American Medical Association, talking to your local providers sometimes will make a difference as well. Or just a lot of states have health. I know in Louisiana, but I think most states, they have hotlines that if you need information on the COVID vaccine, or even a CDC at one point had a hotline. I'm not sure if it's still there. But they're definitely credible out, there's credible information when you go to those in organizations.
Yes. So somebody's just asking if you all, when you respond, if you can speak up just a little bit. I think some folks are having trouble hearing. Make sure your volume's turned up, everybody, too. Okay, so a couple of things. You hear a lot of talking, like where I'm from, where Dr. Jeansonne is in Northeast Tennessee. You hear like there are even physicians that are part of an organization that's going around against masks and against vaccines, and one physician in particular is touting some of those drugs that we've heard talked about. We've talked about ivermectin and what is it, hydroxychloroquine. Yes. So can you all share a little bit about why these things have not been endorsed for the treatment of COVID-19 and why we ought to be careful when we start to think, oh, well, these things are better for us to use than actually going to get the vaccine and making sure that we're protected? Because I think people hear things like this and it's just an easy, oh, well, I don't know why people believe it, but they do. So yeah. I know, Dr. Jeansonne, I know you do a ton of research all the time, which is one of the reasons why I love talking with you, is because you do. You stay up, you finish house calls, and you come home and you're up until 1 and 2 in the morning reading. So share with people about like some of those drugs and what they ought to know about that.
Right. So I think it's important to realize that I'm not necessarily a drug expert for adults, but the FDA and the CDC get a lot of flack for a variety of reasons, some of it deserved, but they are really incredible organizations. And they have people who simply review and pick apart data and make sure that not all studies are equal. Not all the information is equal. And so they have experts who look at that and try to assess bias and weaknesses in how the studies are done. And so I think that they're very, very good at that. And one of the things about ivermectin, and we see this with antibiotics, actually, in vitro, which means when you're in a lab or in a petri dish and you try to have an effect, that may not carry over to in the human body, which we call in vivo, right? Like during life. So I do understand that people are looking at some of these studies with ivermectin that are done in vitro in a lab or with virus by itself that show that it will not cause spread, or it might limit spread, but it does not seem like this carries over to the body. And the other concern is when people get in these, like, I call it a drug fad. The opioid epidemic was a drug fad, right? And we in medicine shared that responsibility for contributing to that. I will admit it. And I think that that is a big part of distrust right now, actually, in medicine. But when you get into these drug fads, people will do things to get medicines that are inappropriate or unethical. For example, taking veterinary medicines that have additives that are not appropriate for humans. And the FDA has had quite a number of reports of people having adverse reactions because persons were taking medicines that are not appropriate. And there are drug interactions that people may already be on medicines that they shouldn't be mixing these things. Hydroxychloroquine is not without problems. And when people take it before they need it, or when it's not indicated, without a conversation with a physician and knowing all the risks, that can be one problem. But the other problem is, I don't know if y'all remember at the beginning of the pandemic, it went in shortage, and people who really needed it, people with lupus, people with other medical problems, they could not get it. And so I think, if it worked, medicine would absolutely be giving it to you. If we consistently felt like it was effective, trust me, everyone's like, it's all about the money. It's really not all about the money. And if we could do it, we would. Now, I do want to talk about Decadron. Honestly, Decadron is one of my favorite medicines in like the whole wide world, because there's nothing better than me not being able to breathe. And you give me Decadron and it makes me better. Like, I'm happy, right? But it does, like, when people give it to me for my asthma, it's because my own immune system is overreacting to a trigger, right? It got a virus a week ago, and now it's overreacting to that virus, and it's causing me more trouble than another person who just had a virus and got better and their immune system didn't overreact. So that is what, but it actually does affect it makes our immune system lag. And so when you initially get a virus and you take Decadron, that can actually let that virus spread more easily, right? And so that's why we're saying in the outpatient domain, if you're not very sick and you're able to stay home and take care, you do not need this steroid. And you can actually cause some problems for yourself later if you do get worse. Then your adrenal gland and other organs may actually be suppressed from making natural steroid, which you need if you start to go into what's called cytokine storm, which is one of the things where they do give steroids if you're doing very poorly with COVID. So there's good science behind the recommendation of telling people, like, hang on, there's a reason for it, but just don't be popping Decadron all the time when you don't need it. So I think those are things I want people to understand. But I do kind of want to go back to something, because you talked about fear. And I do house calls, and I'm sure Nicole sees this in the office. Everybody is sort of afraid. They don't want their parent or their child or their loved one to be the one that's hurt, in general. I mean, and I think that, I don't want people to live in fear, and the fear is real. And I'll tell people all the time when they do get sick, like, this is what you need to look for. And the likelihood is you may do well. You may do fine. You may not go in the hospital, and your child may be jumping off the walls during quarantine. Like, I understand that. So we don't do these things to make people fearful. And actually, some of the easy measures, in our area, holistic medicine and doing natural things is a big deal, right? So instead of taking some of all these medicines that you don't need, just cover the snot on your face. Just cover it so that we're naturally not sharing it. And we really did see last year, pediatricians were not busy. Some of them were worried that they would not be able to maintain their business. They had to take out loans. They took out loans from the federal government because they weren't seeing typical childhood illnesses. And I've seen on social media people say, well, now when you took the mask off, did you really think a kid would never get sick again? No, of course, we expected this when masks came off. We expected that there would be a peak in RSV. But the problem right now is we're peaking in everything. motor vehicle accidents, four-wheeler accidents, things that have boating accidents, RSV, para-influenza, and then we're in the middle of a pandemic. And our health system cannot manage this, especially right now in the Deep South. And what tends to happen is these things with RSV and para-influenza start in the Deep South and move their way upward into other areas. And so I have really been watching Mississippi and Louisiana and Florida, because I feel like our time it may come unless we do some of these easy things. So sorry to get off the medication topic, but I
No.
felt
Oh, that's okay. Well,
I
just to
love
kind of piggyback on what you were saying, Susan, um, as far as medication, I wholeheartedly agree with you as far as the indication for the meds. Going back to Decadron, Decadron is a commonly used med for some people use it for everything. So
right.
definitely like to restrict it. Their explanation for restricting it during COVID is definitely something that's very, very important to note. Unless a patient actually needs it for other reasons in addition to COVID treatments. So I think that's very important for patients to understand, because a lot of times it doesn't matter what the patients have. A lot of times everyone wants that shot of steroids. It doesn't matter what they're covering. And I'm usually that provider that has to explain that you can't give steroids to everyone. There's a reason for steroids, and to do my spiel on steroids, and when it's indicated and when it's not. So definitely that's important to keep in mind. And then the other thing is, as far as the FDA approval, the vaccine is FDA approved. I mean, it's an emergency approval. But when we were saying, as far as picking your battles, when we talk about credible sources, the information, you have so many different sides, as you mentioned early, Danny, so many different sides of things. So when we could talk about the medications, we could also talk about the vaccine. What are the pros and cons of the vaccine? What testing has been done? And then not only that, but we had a COVID surge just last year when the pandemic first started last year. We know what works. We may have not perfected everything, but we know that masking, we know that social distancing, we know those things work. So it's better to build upon what you have instead of trying to reinvent the wheel, essentially.
And understanding that as we know more, people think, oh, well, they said this in March of 2020, and now they're saying something in August 2021. Well, that is common sense, right? The longer we have it, the longer that we study it, we see what's working, what's not working. The medicine and the science changes as you get more data, right? People act like, so I would love for either of you guys to tackle emergency use and approval by the FDA versus experimental, as if it's just some half-wing something concoction they've thrown together, and because you hear that terminology, it's an experimental vaccine. Talk about the process for approval, even if it's for emergency use.
Well, dealing with the COVID vaccine, even for myself, as I said, I was a little resistant in the beginning because I'm a reader. So I have to research everything before I participate. And so even though I was working in a pandemic, I was ready for it to be over. And we were looking for answers and treatments. When there was talk of the vaccine, I just, in the back of my mind was like, it's something new. I'm not sure if I exactly want to just jump on board, maybe just wait a little bit and see. But as we start seeing more and more people affected by COVID, as I said, that makes you stop and think. And once I started looking at research, COVID is new to us. Coronavirus has been around for years. It's just different strands. Just like now we have this new surge, we have the Delta variant, and then sound like leading behind that, we have Lambda that's also approaching the U.S. That is also in the U.S. In Louisiana, we've had some cases of Lambda as well in certain areas. But just like anything else, it has been, as far as this vaccine has been tested against the coronavirus. I can't say exactly what year had been tested, but there had been research previously. And so what you're doing is they built upon the information that they already had about the coronavirus in order to develop the vaccine that we now see.
So I've seen people actually say, oh, well, the vaccine is what's causing mutations and variants. And from what my understanding is that these vaccines do not carry live virus. So so therefore it's not going to mutate because like in your genes, because it's not there and it's not present. So I think it's important for people to like literally on a thread, the person who said this to me threw up a YouTube video. And so I was like, well, here's this medical article that maybe you should read versus this YouTube video that is giving you this misinformation. I think people are using the word mutation to and intertwining it with variant and not really understanding a lot of these variants we were seeing last fall at different times. So like you just said, Lambda, I promise you somebody's going to be like, there's going to be somebody who is watching who is going to act like something new has just transpired. I want to make sure that I touch on, because I want people to be able to also ask questions if they have them, because somebody said that they did have a special needs child and they were going to ask kind of your opinion. And I know that you all are going to say this, but I'm also going to say this. No one here is giving you medical advice. They are sharing their medical expertise. So don't come looking for me or them. This is for your general knowledge. This is to help you so that you have good information to go back and talk to your own providers and to do better research for you and for your own family. I have heard there's so many different things. Susan, I hit you up the other day and I said, hey, what's the new, because you know, it's ever changing. What are the requirements for quarantining? Because there are parents who are getting notices from school saying your child has been, high risk contact or close contact. And literally in this message, they told the parent, there was no question of, is your child vaccinated or not vaccinated? It was, hey, your child's had a close contact exposure. He or she can still come back to school unless they develop these symptoms. And my question was, is that what we're doing now? And you were like, oh, it's kind of confusing. So if you guys could briefly kind of say, okay, well, this is what we know about when and how we should be quarantining and that sort of thing after a close contact.
So it is very confusing now. And part of the reason it's very confusing is not only vaccinated and not vaccinated, but I believe that the CDC does recognize that people have to go about and live their lives. And they want to make every effort to get you back to your life. They're not trying to, control you and keep you in your home forever, which is why some of these variations have come up. I don't feel like I can break it down adequately. I will tell people, and this is not a plug. I mean, honestly, it is not a plug for my business, so don't take it that way. Especially this week, I'm really busy. No, but so I do have the link on my Facebook, Healthy Sprouts and House Calls, but you can go to TDH and just look up quarantine and isolation. It was updated. Literally, I made a video one day and it got updated in the next day. And I was like, what? So yeah. I put up a new video, but I do have the link and I put some pictures of it. I think one of the things that's really confusing to me is there is the offering that in K through 12, if there's appropriate physical distancing measures and you feel confident that those kids have been masking appropriately and they have a contact and the kid's not showing symptoms, they could potentially still go to school. I can tell you from experience in our area, and I mean, even in my own household, I can't convince some of my family members to mask regularly. So I go to TJ Maxx, I go to Panera, I go outside of schools and just see people are not masking. So to me, if the school is telling you, I want to go see that school, I want to check it out and see who's doing that in my area. I do think there are schools maybe in other areas. I saw a Missouri study that looked really interesting, that they worked really hard through testing and masking and certain criteria to keep kids in school, and it looked like it worked.
Yeah.
But I think it's it does divide into whether in a household, whether you're vaccinated or not vaccinated, whether you can truly isolate. For my parents who have toddlers and young kids, they can't put them in a room with their own bathroom and put food outside the door.
Right.
It's not happening. So
And I think
oftentimes,
also, Susan, it's important to define what a close contact is.
right.
That makes a difference as well, because a lot of people will say exposed. And so you always have to dig deeper to find exactly what type of exposure. Was it an in-home contact? Was it someone that they had been around for 15 minutes or more? So those things are important in defining the type of contact.
Yes, yes.
Yeah.
So I think if you're really uncertain, I've had parents, like, we have a positive or something, and I tell them, look, I am going to send you this guidance by email, if you're okay with it, because, email is not secure, but I'm going to send it to you, and you're going to read it like 5 times, and you're going to be like, I still don't get it, because it took me like that many times, and I had to like make a chart.
Right.
Then if you're in that position, you still don't understand, call your pediatrician, call your doctor, call the health department so that they can help you figure out what's right.
Yeah.
If you are still having trouble grasping what it is, but the explanations are all there. You just have to figure out which part you fit into, and you have to be honest with yourself. Are you really isolating? I mean, some teenagers on their computer were made for isolation. They were made for lockdown.
Yeah.
But then some can't. Some little kids are all in your face, and so that's not isolation. So you have to be honest.
Yeah, I have the difference between like Dominic and Bella. It's a perfect example. Dominic is more quiet and reserved. You can put him on his computer or the app or the iPad, and he's good. He's golden, right? Bella, when she goes to the playground, she literally says, Tutu, we have to go to the playground so we can meet my friends. Now, they are not people she's ever seen before in her life, but they are her friends. And
Right.
that is the difference between those two children, right? But even having said that, I think one of the differences, so there was this great, you guys saw the what was it, the pepper with the soap in the dish, the germ deal. Do you remember this? There was this video. Yes. So when this first happened, gosh, it's hard to believe now, but Bella wasn't even 3. Isn't that crazy? My grandbaby's been wearing a mask since before she was 3, and she just turned 4. But one of the things that we did was I got because to me, kids learn really well this way. So I got the dish with the water and the pepper, and I let them do it and put the drop in it and put their finger. And when they understood and they got that visualization of, hey, this actually keeps the germs from getting on me and staying on me or whatever, even at 2 and 3, I can take them. I have taken them to the Georgia Aquarium. I have taken them to the zoo. And when we're not like in line for the giraffes, then we can take our masks off, right? But when we're in line to feed the giraffes and we're all kind of like whatever, we put them on. But they know, and they're really great. So I also think a lot of it, just to me, is how we as the adults frame it for the children. Right? Because they lean on us to guide them. And so if we make it something that we can do, and we know, sometimes you're going to have kids that are better at it than others, right? But we can eliminate a lot of the hesitation and whatever around it if we position it, in better ways. There's a question. So Jamie says, parents are usually so quick to protect their children. In East Tennessee, it seems like parents are doing everything they can to give their children the best chance to get a deadly virus. What do you say to parents who refuse to take precautions? Either of you guys want to tackle that?
I don't mind. Nicole, do you have anything that
The
you've
only
had?
thing I would say, if they absolutely refuse, I'm sure they've heard it all before, but just kind of reiterate, or if we could give them like numbers, and the biggest thing I think is to sometimes discuss your worst case with people to help them understand the risk, exactly what you're looking at. Because to be honest, until you're actually, just like in Louisiana, as well as I'm sure other places, like several adults that refuse to get the vaccine, but then when they're in ICU or they're about to get on a vent, they're about to be intubated, they're asking for the vaccine. or they're
Yeah.
saying what they wish they had known. So I think it's those type of stories that may be more leave a more lasting impression for some people, because sometimes this may not be real to you if it hasn't affected you directly.
Yeah.
Yeah.
Susan?
Yeah, well, I have two things. One of the things that I try to make people understand is that we're a community and we're on a team. When we look at an infectious disease that's spread, we try to we want to try and frame ourselves as a team, that we're not like an island all by ourselves. We do interact, we do share things. And a little bit different. I try not always to tend. I mean, people see the negative stories all the time, and then they see their friends who get COVID and do fine, and that reinforces their belief that it's all fine, or they get it and it's all fine, so it's not necessary. But
Yeah.
I think this is a bigger problem, and it's been a really big struggle for me since pandemic. I mean, actually, it's been longer than this, like 3 years of struggle. I've been a registered, and I've told Danny this, I've been a registered Republican since my 18th birthday. And I most of the time am conservative in how I vote and how I look at marriage and lots of things. I do lean toward more of a kind of the middle on like social, things rather than very, very right conservatively. But I'm not sure. Growing up, it was the responsible thing to do in my very Republican household to get vaccinated and to be a good public health partner, to wear our seatbelts, because I had to start wearing seatbelts during my life. That was mandated by the public, and everybody was like, that's ridiculous. I can just throw my arm out there and hold you back in that seat. My
And it's funny
mom,
when I tell my kids that.
yeah, my mom and dad were like, no, seatbelts are important. They save lives. This is what we're going to do. And then when car seats came out, it was kind of the same thing. And we were like the family that was drilled into us that we were productive, we worked hard, and we took responsibility for ourselves and for others. And like that was kind of the Republican way. And I just feel like I don't belong anymore in this mindset that it's about the government's out to get me, and they're trying to control me and all these other things, and that's why you're getting this, which I don't like the word jab, it drives me crazy, but I've struggled internally with this, and I don't see it that way anymore. And so I've had to really decide, like, where am I in all this? And honestly, politics to me has nothing to do with it, and I feel like some of the politicians really need to take a step back. I'm more than happy to refer the 40 something thousand kids who've lost a parent to one of them to see if they're going to help provide for that child for the rest of their life. And that gets me super emotional because this is such a huge loss. And if a mask and washing your hands and getting a vaccination would prevent it, I think most of us, if we were faced with that, would probably say, we don't want that.
Yeah. Yeah, we have had this conversation because so on some things you and I are like, yep, we get it and we agree. And then there are other things that we're like, well, we're a little bit different. But what I truly respect about that is the ability to have very different ideas on some things. But when it comes down to the basic humanity and responsibility of each other, right? So with personal choice comes personal responsibility. And, like when you said, I think about the 40-some thousand children who lost a caretaker, a guardian, a parent in the last year. I get super, when I think about the impact on these babies for the years to come. It's really going to be something to see how our kids do as adults, especially in a country where out of all of our health system has its challenges, right? But one of our biggest challenges is in mental health. So that's, and especially in certain cultures, right? So you layer that sucker on top of it, so not only do we as a country discount mental health, but then you get into these smaller niches and smaller cultures and communities, and it's even more so. And so I wonder, are we doing our part to protect and equip our children and each other, and this lack of empathy and this very polarizing, it's got to be, I don't know how you take a public health crisis and turn it into politics.
So that's been the way I connect with people who disagree and don't want to do things, is that I connect with them on the fact that, I am conservative.
Mm-hmm.
And this is how I'm seeing this, and this is my experience. And I don't know that it helps, but I'm making my best effort.
And I think that
public health.
Go ahead.
Can you hear me? I'm sorry,
Yes.
It's going in and out. I find that this pandemic, I think, as a nation, aside from how it's affecting the world, but I think as a nation, it has pointed out a lot of areas that we really need to all come together to work on. It pointed out the health equities, the racial disparities on top of the health equities, our educational needs, different deserts that we have not tackled in different communities. So I think that this pandemic, on top of, affecting the health of everyone, I think it's pointed out our inadequacies in so many different areas. And so regardless of whether or not you're independent, Democrat, Republican, I mean, at the end of the day, it doesn't really make a difference.
Right.
We all need to come together on this.
Yeah, COVID's not checking to see who you voted for last time to determine whether or not it's going to infect your body. Like COVID's not caring. And so the way that I would like to look at it is that COVID has, so here's at my core, I believe everything that happens is working for our highest good, right? At the end of the day, even the bad, right? So in this environment, this global pandemic has highlighted very important opportunities that we have to improve who and how we are with each other. Now, there will be people who watch this and be like, well, Danny, I saw you drag that doctor the other day. I will, because here's the thing. When I see someone doing what I believe is causing harm, I equate it to Jesus turning over tables in the church, right? Because I just don't think that, I think that we have to be responsible in how we do things with each other. And right now, I feel like we don't have time. I feel like we don't have time to beg people to get it or to do the right thing. I feel like, and this is when I get upset, like I have intentionally not watched a lot of news because it hurts to see what people are experiencing and living in. And I think about, so I have friends that are watching that are healthcare professionals, and my heart hurts for them because they went from being the heroes of the day to now they're the devil. And on top of watching people be very sick and die by themselves, they are now being ostracized and even condemned by other people who will need them to save their life if they get sick. And it's just very frustrating that we can't seem to get it together when it comes to something so serious. Yeah. Does anybody else, Teresa said, just getting my connection to work. That's okay, girl. You can watch it on the replay. So really quickly, does anybody else have any more questions that these two incredible physicians can answer for us? And if not, is there anything that the two of you would like to leave? Any nuggets? And I will tell you, you said it's not a plug for your business. I plugged you all last week. I will plug you again today because I remember last year, you probably remember this. I remember last year when we were quarantining and my daughter had gotten COVID and her husband had gotten COVID and I wasn't feeling well and Bella had like a fever and I was just like, so after like day 3, I was like, hey, okay, what do I need to do? Because you have 100% earned my trust as a physician. Like I trust you with my grandkids, which is why I wanted to bring you on here, because I feel like I can very comfortably say, follow her. She's got phenomenal videos. Like when people talked about the myocarditis that can come from the vaccine, she did a great video about that. is able to really break those things down so that all of us can understand. And here's my thing, folks. If you can't even read when to quarantine and when not to quarantine and figure out what basket you belong in, stop trying to figure out whether or not the vaccine works or what medicine you should be taking. Trust the folks that this is what they do for a living, right? There's a reason that we have that. So, oh wait, Kathy Weeks-Quall says, what about the people that think the vaccines change the DNA? Because people do say that. I know that it doesn't, but do you guys want to address that real quick?
It's a messenger RNA vaccine, so you don't have to worry about changing your DNA. You think it's pretty safe for that.
Yeah.
It's not possible.
And so I wasn't going to plug, but if you go to Healthy Sprouts on YouTube, I have my very, very first video, which had like over 5,000 views. And I don't even like social media. My kids were like, you need to do this.
Yes.
They made my YouTube channel, but I go into very much really understandable, I think, detail. And I think I had 5,000 and something views because of that.
Yes.
And it'll describe for you, Kathy, why it doesn't change your DNA. So, and if you're asking for talking points with friends, it'll give you talking points for friends.
See, and this is what I'm saying. So if you're going to go to YouTube, at least go to a reputable physician's YouTube channel and it's Healthy Sprouts and House Calls. And this is what I really do love, because I think people forget that the average reading level across the country is like what? 6th grade is the average reading level, right? So when you think about that, and I know in some parts of the region where I'm from, where you are, it's even lower than that. And so to think that, we can expect folks to just get it and to be able to understand all of these studies and the ever-changing science of and information behind it. I personally would rather not do that work. I would personally rather find someone that I know understands it, has studied it, done her due diligence or his due diligence behind it, right? And who has reputable sources, and trust that. Julie Knipe says, what symptoms are you seeing lately in children with the Delta variant?
I was kind of seeing fever, just like cold symptoms in majority of the kids that I've seen. I mean, you have some that have respiratory distress or have worsening symptoms, but most commonly is cold symptoms and fever.
Along that line, so Dr. Jeansonne, you had mentioned we're seeing breakthroughs. And I think sometimes when people hear that, they think that means, oh, the vaccines aren't effective because people with COVID can still get them. And what I try to say is, you know, we would love for a vaccine to mean you're not ever going to get the thing, right? However, right now what we know is it will lessen your chances of getting it and will drastically reduce your symptoms. So like my daughter, who's 27, just had COVID, but she's fully vaccinated with Pfizer. So she felt like crap for like 3 or 4 days. Just when I say crap, not even like crap, like she had a runny nose. She was like, Mom, I was sweaty last night. She was like, this sucks. You know, typical 27-year-old, this sucks. But, you know, she was good in a week, right? I firmly believe my uncle, who is 80, he's a cancer survivor, just had colon cancer. So definitely immunocompromised and all of that, but he's fully vaccinated. He got COVID just a month ago. And I had talked to him on the phone and I asked him, I said, are you checking your oxygen levels? And of course he was not. And I said, you need to do that. Well, and I said, and if it's below 94, you need to call them. So he did. They put him in the hospital the next day, 5 days of antibodies, antibody treatments and what have you. And he's home. I do not know that would be the case for him had he gotten COVID a year ago, you know, immunocompromised and at his age without being vaccinated. So for me, those are very real things. I know the difference between people who are vaccinated and not vaccinated and oftentimes what their experience is like. So
Julie, I'm in a listserv with a group of pediatricians. And there are several who are in the PICUs in Alabama, Mississippi, Louisiana, and Texas. I haven't heard a lot from anybody in Florida, but I know Florida's having a rough time. Mm-hmm. And it appears that, you know, it's still a wide range. You have kids who just cough. You have kids who are asymptomatic. You have those who do run fever. You don't have to run fever. And then for some reason, it does we don't have all the data yet, but there is some suspicion that Delta is a little bit different, a little bit more trouble for kids who have respiratory problems like asthma. Obesity is a huge risk factor for children. Being Hispanic is more of a risk factor than being African American. We don't entirely, it may be health disparity, it may be other reasons, because some of these people aren't, in a low socioeconomic status. And so we wonder, like, why is that happening? But we are seeing some increased pneumonia, and some people are thinking because we're seeing co-infections, RSV and COVID and adenovirus at the same time, that maybe these things are also problematic right now for Delta variant in children, which goes back to the idea of let's not share our snot and our droplets. If we can reduce that burden for children and for our communities, adults get these things, they don't get very sick from them, and they share them with children. So I hope that
it also depends. I think it depends on the immune status, because when RSV was higher, especially in the early summer months, when we were seeing a lot of patients with RSV, some of the adults that may have had chronic health issues, respiratory issues, we saw some of them get very sick with RSV as well, which I had never seen before.
Yes.
See, and that's the thing. I think that people need to understand that all of this is going to be new and different. There's just not one blanket statement that is going to fit every single person. I have been diagnosed with one autoimmune disease, right? So for me, I know my body, like I'm wearing stripes, maybe because like half the time my stuff is zebra-like, right? So that's when like there's not the straight, and narrow response and the way to figure it out. But so one of the things that I also really admire when it comes to you, Susan, is the fact that we talk about being healthy, like around. So it's amazing to me. You still find time to garden. We talk about, but so one of the things that I've said to people is, because I do like some holistic stuff, right? I got some vitamin D3 over there, and I got a little bit of ashwagandha in my life. I also know that if my ass gets COVID, I am not relying on those things to save my life. But here's the thing. I think that we have to be prudent and understand that we live in a world where most of the time, especially in socioeconomic challenged areas, we are eating lots of processed foods. We are putting a lot of impurities in our body, which hinders our body's natural ability to fight some of this stuff. And so, yes, we should cover our snot. And yes, we should get a vaccine. And yes, we ought to take responsibility for the bodies that we have and what we put in them. So like when you said obesity, childhood obesity is a big factor for our children, right? So, yep, the Happy Meal is easy, right? But at what cost? And so one of the things that I think COVID is bringing up is this opportunity for us to examine how we are living and what are we doing with our bodies, and what could we be doing differently? Not to shame people or make people feel bad, because listen, I will pop a fry in a minute and a cookie when I want one, and have it outweigh, you know what I mean? So like eat balanced meals, and not a lot of anything, right? And be better off in that way. So Michelle Ivy also asks, are you seeing long-term complications in kids after Delta? I don't know if we have enough data to even know that yet, do we?
It's pretty new, so I think we'll probably have to wait.
Yeah, we don't know yet. And I think that's the thing. If I weigh what we do know versus what we don't, what we do know is vaccines work. What we do know is wearing a mask and physically distancing helps reduce all of these other co-illnesses and things like that. So since we don't know what this is going to look like a year from now, 5 years from now, do the things that we can do together. Any other nuggets of wisdom that you guys want to drop? I want to be respectful of your time and not keep you on here forever.
I just want to point out that we still have a lot of questions and concerns about myocarditis from COVID itself. And there are kids who are sick who sometimes have passing out episodes, adults too. And when that happens and a child like wakes up from that passing out episode, an adult, you need to contact your doctor. You might not need to go to the emergency room right away. They will triage, but there does need to be an assessment and potentially at some point an EKG and an echo. Whether your child looks mildly ill or has, 4 days of fever, they need an assessment, because we are seeing from the disease, there is some myocarditis associated with the vaccine, but the numbers are actually larger with the disease. So, when your kid's on quarantine and they're telling you they have chest pain and feel short of breath, don't let them go skateboarding in the driveway. Okay. They do need a rest. And if they're having chest pain, they're complaining to you, or they have a passing out episode, or shortness of breath that you can actually, they'll tell you, that is something to give a phone call to the doctor.
Awesome. Great information. So once again, I want to say that I appreciate both of you all's time. Nicole, it was great to meet you for the first time. I knew you were going to be awesome because you were coming through from Jeansonne. So just great individuals. Folks, if you don't have a provider that you trust, find one. Get a physician that you can trust, so that you can do what you need to do for you and for your families, right? We can prevent a lot of what's happening right now, and we owe it to each other to do that due diligence. And even things, y'all know I was not comfortable getting the vaccine, and yet, I just had to weigh it out. And when I changed my mind, I did it publicly so that you all would know, because what I didn't want to be responsible for, somebody be like, Danny said she wouldn't get no vaccine, and that'd be last year. Let me tell you today, I got it. I went on to Walgreens and got stuck. And here's the thing. I went to Walgreens, even though I'm a disabled veteran, because I didn't want to do Moderna. When I was reading about who was doing what and where the money was coming from and who was involved in research and all that good stuff, I was like, okay, if I'm going to get this thing, it's going to be Pfizer. Because I was joking. I was like, Johnson & Johnson give people cancer from talcum powder and stuff. But I say that jokingly, but y'all know the history. So, oh, yay, she finally made it. Okay, wait, this was one question that somebody said they wanted to ask. She says, what if you have a special needs son? Would you get them the shot?
So I do think that this is a conversation with your doctor. There's lots of things that you need to think about. It depends on what the special need is and what the risk. It's sort of a broad question. Special needs could be autism. It could be on a ventilator with a tracheostomy and, other complications, which put your child very, very much at risk. So I think this is one of those things. Look, your doctor wants to talk to you about it. So make an appointment or a telehealth just for that conversation. I promise you, they want to talk to you about it. And it might be 20 minutes. They might be able to send you to a place that has trusted resources so you can gain some more information.
Yeah. So she put some additional info. She said a VP shunt, feeding tube, breathing problems. So yeah, this is definitely a conversation you want to have with your physicians. Yeah.
Yeah, definitely. And they want to hear from you. They do want to have this conversation.
Yep. So find someone you trust. One other question was 8-month-old has COVID. Should he see a pediatrician immediately for follow-up after quarantine?
I don't know, Nicole, if you want to offer anything. I think that if you're home and an infant is feeding well and doesn't have more than 3 days of fever and is immunized for all the other childhood diseases, you wouldn't necessarily have to go in. I don't think there's anything wrong with a telehealth visit, though, to get guidance on how to care.
I do it on a case by case. Definitely if it's the patient that's asymptomatic, I think we should be fine, because I routinely just do symptomatic care. As a majority of kids, they do well. So I would just do symptomatic care with them. If they're for any acute changes, anything at all, I would say definitely you need to consult.
Yeah, I think the important thing to remember too, folks, is that hold on. So the person who asked you, and they're probably saying, and this is probably my fault because I said I trust you. So they're asking you, because she said his doctor doesn't. They asked. She says that she's asked the doctor and they've said nothing to go on, that they don't see the point of him getting it.
Getting what?
Getting the vaccine. This is the child with the VP shunt, feeding tube, breathing problems. So Clarissa, if you don't feel confident in that, maybe get a second opinion, if you don't like the response that you're getting from that physician.
And maybe a discussion with the specialist who monitors some of the other aspects. Yeah. There
you go. Awesome. I told you it was going to be my fault because I was like, yeah, this is I trust. So anyway, I appreciate you all very much. Hopefully this was beneficial for those of you guys who were watching. I'm going to go ahead and get you guys out. Thank you all very much. Remember that this is, and I know, so you're in Louisiana. I haven't even looked to see like what my reach is in Louisiana. I'm primarily like North Carolina, Georgia, Tennessee, Virginia. However, I told you for me, one of the benefits to having you here was representation, because so much for us and for Black and brown people and people of color, there's so much distrust around medicine, healthcare, vaccines, government. So I appreciate you being able to fill in the gap, even for a region that, I may not be able to shoot some folks your way. Right.
Thank you.
But my thing is, folks, find physicians that you trust, that you believe have the best interest of you and your children and your well-being. These folks did not give up their entire lives and get all their student loan debt that they got to not give you good information. They don't want you sick, right? Especially if you're in peds. I just think that these are special individuals and we should appreciate them. And I do very much appreciate your time, your wisdom, and your willingness to be here. So I appreciate you all very much.
Thank you.
Thank you. Good to see you.
She said, good to see you. All right. So guys, that is it. I hope that this was informational and beneficial for you. I'll be here on Thursday and we're going to be talking about a few different things on Thursday. So I'll put some information out. Don't forget that on Wednesday, the regular audio podcast, new episode will be up. So whether that's iTunes, whether that's Google Play, wherever you listen, it will be up on there as well. So make sure that you follow and subscribe. No matter where you are, you can go to Healthy Sprouts and House Calls on YouTube and watch Dr. Jeansonne's videos. You can follow Healthy Sprouts and House Calls on Facebook, and at least get some more information that you can talk to your own physician about, that you can talk to your own specialist about. But we've got to start remembering that we are all in this together. And so our choices impact everyone. And, we got to do what's best for everybody. So I appreciate you all very much. Y'all know how I end this thing, right? Be amazing, be light, be love. Peace.